And we are back, friends. So we are discussing the drugs for angina pectoris. In the previous video, we had covered the first group of drugs, that is nitrates. We will continue with the second video in drugs for angina pectoris, and in this we will cover the PFOX inhibitors. So, which are these PFOX inhibitors? The two drugs available are ranolazine and trimetazidine. Among the PFOX inhibitors, the two drugs available are ranolazine and trimetazidine. What is the mechanism of action of ranolazine? Number one, it inhibits something called as late sodium currents in the myocardium. Ranolazine acts by inhibiting something known as late sodium currents in the myocardium. And because of this inhibition of late sodium currents, it can indirectly prevent the myocardial calcium overload. It indirectly prevents the myocardial calcium overload. And naturally, if the calcium overload is reduced, or rather if the calcium content is reduced, then the work, that is the force of contraction, is also reduced and the myocardial work is also reduced. Right? So ranolazine inhibiting the late sodium current will indirectly reduce the calcium content so that the cardiac work done is reduced due to a reduction in the force of contraction. Also, another mechanism is it inhibits the PFOX enzyme, which is why the group is known as PFOX inhibitor. And the full form of this PFOX is partial fatty acid oxidase. This PFOX is an enzyme, partial fatty acid oxidase, which is involved in the fatty acid oxidation. In the mitochondria, the beta oxidation of fatty acids is brought about. In this pathway, one of the enzymes is partial fatty acid oxidase. By inhibiting this enzyme, by inhibiting the beta oxidation of fatty acids, the ATP production is reduced. And because the ATP production is reduced, there are alterations in the activity of various ion channels and pumps, which can lead to an improvement in the coronary blood flow. By inhibiting partial fatty acid oxidase, ranolazine inhibits the mitochondrial beta oxidation pathway. Therefore, the ATP production is reduced. The activity of multiple ion channels in the blood vessels is altered, because of which the coronary blood flow is improved. So just like nitrates, ranolazine is also another drug which acts by both the mechanisms, by decreasing oxygen demand as well as increasing oxygen supply. Correct? Just like nitrates, ranolazine also reduces the cardiac oxygen demand and increases the myocardial oxygen supply. Because of this, it is effective in angina. So where do we use ranolazine? Today it is one of the first line drugs for chronic angina pectoris. It is today considered as one of the first line drugs for chronic angina pectoris. What is the dose? 0.5 to 1 gram administered twice a day. It is administered as a sustained release tablet. Ranolazine is a sustained release tablet administered as 0.5 to 1 gram twice a day. This drug is also claimed to be a cardioprotective. Studies have shown that ranolazine also has a cardioprotectant action, and plus it is also believed to improve glycemic control. Ranolazine has got two other advantages. It is claimed to be a cardioprotective drug, plus it can also improve the glycemic control. So sir, what are the adverse effects with ranolazine? It can cause headache, dizziness, weakness, constipation, dyspepsia, postural hypotension and QT interval prolongation. Headache, dizziness, weakness, constipation, dyspepsia, postural hypotension and QT interval prolongation. These are the adverse effects with ranolazine. So question has been asked here, which of the following drugs acts by inhibiting the late sodium current in the heart? Yes, We have just discussed, sir. Answer is option B, ranolazine. So ranolazine we saw has got two mechanisms of action. One is PFOX inhibition, which leads to decreased ATP production and subsequently increase in the coronary blood flow. And the second one is inhibiting late sodium current, which decreases the calcium overload and hence reduces the cardiac work done or cardiac oxygen demand. The other drug that we have is trimetazidine. Now trimetazidine has got the same mechanism of action as that of ranolazine, wherein it improves the coronary blood flow through PFOX inhibition. So just like ranolazine, trimetazidine also inhibits the partial fatty acid oxidase, leading to decreased ATP production and improvement in coronary blood flow. However, it does not have the other effect of ranolazine, that is late sodium current inhibition. Okay, late sodium current inhibition is seen only with ranolazine, not with trimetazidine. So, trimetazidine, where do we use it? It is also used to reduce the frequency of anginal attacks and also increases the exercise capacity. Trimetazidine is shown to reduce the frequency of the attacks of angina, plus it can also increase the exercise capacity. So where do we use it? As an add-on medication in angina and post-MI patients. So in comparison with ranolazine, ranolazine we saw is a first-line drug for chronic angina pectoris. Trimetazidine, however, is a add-on medication. So in patients with angina and post-MI, where they are not showing an adequate response with the first-line drugs, we can add trimetazidine. Right? So trimetazidine, the dose that we use is 20 milligram thrice a day oral. Trimetazidine, the dose used for this is 20 milligram thrice a day oral. What are the adverse effects? It can cause gastric burning, that is GI symptom, dizziness, fatigue, muscle cramps and reversible Parkinsonism. Trimetazidine has shown gastric burning, dizziness, fatigue, muscle cramps and reversible Parkinsonism as adverse effects. So, these are the drugs ranolazine and trimetazidine as PFOX inhibitor. The other group, that is potassium channel openers and the miscellaneous, we will be covering in the next video. See you guys.